Welcome to this Alberta Health Services training video for safe client handling log roll. The information and guidance provided is based on research and best practices available as of January 2015 and is brought to you by the AHS Workplace Health and Safety Department. The log roll method is used when staff are required to insert a device underneath a client who is in a lying position. For example, slings, draw sheets, soaker pads, etc. Workers first begin by explaining the procedure to the client. Next, adjust the bed to the comfort zone, raising it to the appropriate height for the tallest worker. Lower the bed's side rails and ensure the head of the bed is flat. Workers can then instruct or assist the client to lay flat on their back, to cross their arms across their chest, and to bend the knee on the opposite side to which they will be turned. Workers will be standing on the opposite side of the bed. The primary worker will pass the edge of the draw sheet to the secondary worker. The secondary worker will grasp the draw sheet. The primary worker positions their hands open palmed on the client's shoulders and hips to provide directional guidance only. The primary worker counts 1, 2, 3, roll, and on the command word roll, the primary worker gently guides the client. At the completion of the move, the client will be facing the secondary worker. The secondary worker maintains the client in the side-lying position while the primary worker places a device such as a soaker pad or a slider tube underneath the client. The secondary worker will then allow the client to return to the back-lying position. The secondary worker will then pass the edge of the draw sheet to the primary worker. The primary worker will grasp the sheet. The secondary worker positions their hands in an open palm position on the client's shoulder and hip to provide directional guidance only. The secondary worker counts 1, 2, 3, roll, and on the command word roll, the secondary worker gently guides the client. At the completion of the move, the client will be facing the primary worker. The primary worker will then maintain the client in the side-lying position, while the secondary worker places the device under the client. The primary worker will allow the client to return to the back-lying position, completing the maneuver. Remember, stop, look, and listen. Reduce the risk of injury by asking yourself 3 questions. What can the client do? What equipment do I have available to me to complete the specific task? And how can I get into a good body position for this move or transfer? Now, it is time for you to put the information from this video into practice in your job and workplace.